Hi everybody, today we're going to talk about abdominal aortic aneurysms and other aneurysms that can affect the cardiovascular system or the heart system. So I'm going to get the first slide up here in just a second. Okay, there are a couple different types of aneurysms that can affect the aorta, along with actually other areas of the body. You can have an aneurysm in the brain. Not a good thing, but that can cause what they call a hemorrhagic, it's a brain bleed, but it's a stroke, hemo something or other. I'm sorry, I forgot, and I don't want to go back and look. Hemorrhagic stroke. If there's one of these in the brain, these aortic aneurysms, this is a saccular one, and these pop and you can have a stroke if it's up in the brain. If it happens in the aorta, then obviously it's a medical emergency and it needs to be attended to right away. This is a fusiform aneurysm, which is a much bigger aneurysm that's bulged out, but it's less likely to pop than this one, because this one, the tissue is much weaker because it's a smaller area that's stretched out. So those are the two different types of aneurysms and the shapes that we see. Obviously an aneurysm is very dangerous because if it does pop, if it does dissect is the word they use, then you will bleed out relatively quickly. Also, if it just dissects into the tissue, into the wall of the aorta, it'll eventually block off the vessels to vital organs, like these are the renal arteries here. So obviously you want to avoid that, and we'll move on to the next slide. Okay, these are some classifications of aortic aneurysms. There are different places an aortic aneurysm can pop out. Some of them are extremely severe, like this first one here. That's a significant aneurysm. It's on both sides of the aorta, which is very dangerous. Excuse me. And it's all the way covering all the way the entire aorta. So this is a accident waiting to happen. This gentleman here, Dr. DeBakey, who was down at, I think, Houston University in Texas, one of the most talented cardiovascular surgeons. They named several surgical procedures after him. Also one of the biggest jerks you've ever seen in the way of treating his employees and treating his residents. He was terrible. I saw a special on him where I couldn't believe how badly he was treating people. So talent sometimes comes along with a bad attitude or a nasty personality. So I don't know what that's all about, but I've digressed. So let's look at the second one here. This is an ascending aneurysm, and a lot of times when you have one of these, it'll affect the aortic valve. It'll pull it apart. So when they go in and they put in a Dacron or a fake aorta in here made out of heavy-duty plastic, they sew it in right here where the aneurysm stops, and then they replace the entire aortic valve with a new valve that will stop it from leaking. And then this is a typical aortic aneurysm of the thoracic and abdominal area. This bulge way out, and this is also something that you need to address right away. These are classifications of aortic dissection. So these are already have ruptured and they're bleeding out into the what they call the intima layer of the aorta, so one of the layers of the aortic tissue. So they don't always burst like into the abdominal cavity and leak all the way out. They just kind of, tear the internal lining of the aorta and then bulge out. Now this obviously can be very severe because in places like up here you can cut off all the circulation, and that's circulation to the brain and to the arm, so you don't want that to happen. But anyhow, we'll move on to the next slide. Now this is one of those pictures that I'm not always too sure I want to show, but this is what happens to the abdomen after a aneurysm pops. You can see how bulged out it is. This is all filled with blood. And here's a CAT scan, and it shows where the aorta is, and you can see where it bled out here by this bulging area, and it bled all the way out into this abdomen. I do not know if this person is alive or dead, but this is a severe situation that if they were to cut his abdomen open, and the blood would come out like crazy, and they would have to get in there quickly and sew that up or fix that in some way. So I just wanted to show you that, to show you how significant of a bleed happens after that aorta ruptures. Okay, I wanted to show you this. This is one of the repairs that they do for aortic aneurysm. So you can see that they've cut the aneurysm right here along these lines here. You can see on the left here. They've opened it up. This is the iliac arteries down here. And they've opened them up, and they have sewn in a tube. This is what they used to make them out of, was Dacron. I'm not sure they still use Dacron. It's probably a form of Dacron or something engineered a little stronger. But they actually sew this into the top of the aorta where there is no aneurysm, and the bottom of the iliac arteries where there is no aneurysm. And then they just sew up the aneurysm wall, because it doesn't really matter, because there's now no blood flow in here causing high pressures. It's all in this area here now. It's all in the tube. So this is one way they repair it. Now this is still a dangerous operation because they have to clamp off the aorta in, well, the iliac arteries too, and then quickly put that in and sew it in, because you don't want that clamp on for more than 4 to 6 minutes, or maybe a little longer you could get away with if you cool the body temperature down. But the less time you spend with that clamp, the more likely the patient is to recover fully. If the clamp's on too long, they can have a lot of problems, including paralysis. So that's not good to be paralyzed, obviously. So that's one of the procedures that they use. Okay, this is the ultimate of an abdominal aortic aneurysm, where a catastrophe has happened. This is where the wall has completely ruptured, and now you have all this blood flowing out into the abdomen. That picture I showed you of that gentleman with the big stomach, this is what happened to him. So that ruptured completely, and the blood is spilling out into the abdomen. If you can imagine a hole this big, how long it would take for all the blood in your body to basically get out of that hole and into your abdomen. The heart will stop before that actually happens, but it's pretty amazing how quickly it can happen. So I've seen situations where actually my son is training as a nurse right now, and he had a situation where they were charting on a patient. He had just examined the patient was talking to him and everything like that, came in with abdominal pain but also had some other problems, and sure enough, he did his charting and turned around to ask him if he needed anything else, and the gentleman was dead. So it can happen that quickly. It took him about 10 minutes to do the charting, he said. So it can be extremely quick and extremely severe. And of course, there's no getting someone back from this. It's just not going to happen. So, but this is a catastrophic rupture of the aortic aneurysm. Now, this is the newest and by far the best situation that we can have now with an aneurysm. This is repairing an aneurysm with a catheter and a deployment of a graft or a tube that basically bypasses the aneurysm. So they run a catheter up the aorta from the groin area, and they get to the aneurysm part, and they inflate a balloon that has a cage with some cloth around it of some sort, or plastic around it of some sort, and they inflate it, and then they kind of pull it back until they get to the point where they're in good aortic tissue, and then the graft is deployed and the blood will flow through the graft instead of around into these weak areas causing problems. So it's important because the graft itself is just as good as repairing it surgically. And what you've done is you've made a severely significant, dangerous surgery into a procedure that's done in the cath lab that you're in and out in maybe a half an hour, 45 minutes. Now, it takes talented hands to do this. Not everybody can do this procedure, but the ones that can make it look easy. So get yourself a good doctor at a university hospital, a big hospital. Don't go to your local, I need my appendix out hospital. Go find a big university hospital that does this kind of procedure and get it done there. Okay, here are some of the symptoms of an abdominal aortic aneurysm. Now, you have abdominal pain if it's an abdominal aortic aneurysm, but I want you to know that not all abdominal pain is caused by an aneurysm or something that's severe. It can be something as, I don't want to say minor, but as something as like an ulcer or something like that, which can now be treated with medication because they found ulcers are caused by a bacteria in the stomach that can be treated. But if you do get a tearing feeling in the upper back near the shoulder blades, where you feel like something just tore, it'll feel like, or where someone was ripping a piece of cloth, that obviously is a bad thing. That means probably the thoracic aorta has torn, and you need medical attention immediately. So if you have that feeling and you start getting chest pain and everything else that goes along with it most of the time, call 911 right away. And then abdominal distension, I may have spelled that wrong, I'm not sure. That's obviously when the abdomen starts to come out and look distended. You start to look like me with a big belly. And if the distension comes on quickly and you have a lot of pain with it, that's a bad sign. So let's get to the hospital right away. So these are all 911 calls. Abdominal pain, go to your doctor. If the abdominal pain is really severe, just go to the emergency room, call 911 first. I always tell patients that there's a reason why we have a fire department, and they're all well trained. A paramedic will save your life before a doctor will. Okay, so do what you need to do and go to the doctor or to the ER as quickly as possible. So that's my talk on abdominal aortic aneurysms and aneurysms of other forms in the aorta. So I hope you enjoyed it. We'll see you the next time.